Hello and welcome to my channel. My name is Carmelita and I am an LPCIT in the state of Wisconsin. Today I thought I would do a reaction video to a video that I came across as I was just scrolling through YouTube one day this week, and I thought it was interesting. I wanted to share my insights as a practitioner currently in the field, especially coming into the field, as an early career practitioner, and hearing their perspectives, also questioning some of their perspectives. This is a interview between Jordan Peterson and Abigail Shrier, talking about bad therapy and how therapy is hurting children, basically. So let's get into it.
First of all, I started out with a totally different hypothesis. I knew that these kids were getting more mental health intervention than any generation prior, the rising generation. I knew that they were getting more diagnosis and more psych meds and more therapeutic intervention in schools. But I still didn't think therapy was necessarily the problem, because while 40% of them were getting therapy, it still wasn't a majority. And yet we'd seen their mental health fall apart. We knew that the rise in therapy and therapeutic intervention was somehow coinciding with worse mental health. That of course shouldn't be the case. Like with breast cancer, more access, more treatment, better treatment and more access to it has seen, rates of death from breast cancer plummet. And that's what we would expect to see with mental health. And we're not seeing that. But I still thought, it was possibly just the way kids were being raised. Maybe they were being raised differently, or perhaps it was just a smartphone. And then I began to look into what the iatrogenic effects of therapy are. What are the ways that therapy can hurt you? And there's a literature on this. Unfortunately, it's not a literature most therapists want to acknowledge. They want to claim that therapy has this amazing power to heal, but that it can never hurt. And of course, there's no treatment for which that's true. Anything, Tylenol can damage your liver, anything.
Okay, let's pause there, because who is she talking about? Again, who are you talking about? Because when you say that they, meaning therapists, want to claim that it can help but never harm, that doesn't even make any sense, because we have a whole ethics board because it can harm. We have an ethics board that oversees our practices because therapy can cause harm. If it couldn't, there wouldn't be a need for an ethics board. What are you talking about? Who is she talking about? Who is they?
That can help, can also harm. And so I began to look into, well, were these kids getting a lot more therapy? And not only were the harms we were seeing in this generation, the lack of agency, the listlessness, the family alienation, the anxiety, depression, all effects of, the iatrogenic effects of therapy, harmful effects of bad therapy. But we were seeing this, in
Did these effects exist before the intervention of therapy? Did they exist before, or did they just get worse, or did they just stay the same? Was there any measurement? Therapists usually will, at least a lot of us, will use measurements to measure people's symptoms so that we know if we're being effective. We can tell, okay, depression's going down, anxiety's going down, PTSD symptoms going down. We use the same measure every few months so that we can tell. So when you say that the effects of therapy were causing these symptoms, well, the therapist was brought into the situation in the first place because there was something going on. I don't know any parent in the world that calls a therapist and says, everything's great over here, I would just like you to know all of my business and help my child, even though my child needs no help. They don't do that. So clearly there was already an issue that was present. And if you're saying that the symptoms got worse after therapy, then okay, all right. But you're saying that the therapy made the symptoms exist, which doesn't make sense to me, because, well, what were the symptoms before? I don't understand. The whole statement is ambiguous and it doesn't make any sense.
It was it was being applied not only from actual therapists, but all over the schools. And from parents. Parents were having therapists guide their parenting, and schools were having therapists do trauma-informed care with all the kids. So I started realizing that these kids were getting a lot more psychological intervention than I realized, and that it was bad.
Okay, so let's talk about trauma-informed care, and let's talk about why you concluded that it was bad. I mean, you pointed, first of all, to the fact that as there's been more and more therapeutic intervention, as the schools and the universities have been turned into therapeutic hotbeds, the outcome is that mental health has become worse. Now, obviously self-serving therapists are going to say, well, that's just more evidence that even despite our efforts, even more therapy is necessary, right? That's the logical response to that. But obviously, you're not convinced that that's the case, and you're implying at least, or maybe making a direct accusation, that there's something about the therapeutic industry per se that's actually making mental health worse. Now, Greg Lukianoff certainly is making that case, and I would say it's a case that Jonathan Haidt is probably, what would you say? He's supportive of that implication. Why did you come to the conclusion that the enterprise is doing more harm than good? And what evidence is there for that, do you think?
Well, because they're not treating the sick, they're treating the well. So we know that the risk of iatrogenesis, of the healer introducing a harm, is greatest when you're treating people who don't need the treatment to begin with. Okay, so we know that if you're gushing blood, going to an ER is an important thing to do. It's necessary. It's life-saving. But if you have a small bruise, you're much more at risk of getting an infection from the ER, picking up a MRSA or some other bacteria from an emergency room visit than you are than you stand to benefit. And the same is true with preventive care. We shifted from treating kids and treating adolescents with severe mental health problems to the idea that everyone should have therapy. And there we exposed a vast population to the risk of all the known harms of therapy. Now, I'm not someone who's against therapy.
Okay, let's pause again. I can see what she's saying when she says that when you're treating the well, that you are exposing them to potential harm. When you're treating it ill, you're also exposing them to potential harm. I can see what she means there. She didn't say that part, but I was just adding that. But anyway, you can cause harm regardless, and I can see what she means. However, I don't know who she's talking about. Again, like I'm struggling to figure out what therapist she's talking about, because granted, like, okay, I've been seeing clients for like 4 years now, including my internship year, which is before my master's degree, right? And I haven't had that many clients that have come who didn't have any like pathological issue. You know what I'm saying? Like I've had clients, and when there are, let's talk about that for a second. When there are, I frankly tell the parents, like, look, there's nothing diagnosably wrong with the child. This sounds like more of a family issue, or this sounds like more of an adolescent growing issue. Like, this is normal adolescent behavior. And then they come back at me with like, well, if I was, when I was their age, if I would have rolled my eyes and snapped my neck and stomped up the stairs and slammed the door, I would have been smacked. And so, but we can't do that anymore. They're telling us, that's child abuse. And so does that mean that the child needs therapy just because you can't physically harm your child anymore? Like, I don't see the connection. It sounds to me like you're the one who needs the therapy because you can't figure out a different way to discipline your kid other than laying your hand on them, because that's what you know. Like, yeah, that's what you know, but there's other ways and other methods to do things. And granted, I grew up in a Black household. Spankings were part of the deal. belts were part of the deal. That is the choice that, that my parents made. And as a parent myself, I have my own opinions about things based on my own, how I know that I am when I get stressed out or angry. I know that if I, adapt to that spanking, then I might, take it too far, because I felt like at times when I was a kid, it was taken too far on me. And I don't want to perpetuate that into my family. So that's just me. That's a personal me thing, though. And every state has their own laws about what is spanking, what is child abuse, what are the differences. And so I won't even get into that because that's going to be a different video. But what I'm saying here is, as a therapist, when a client comes to me and says my child has issues, and I do an assessment, and I do and I do a cross-cutting symptoms measure, and I still can't find and I'm like, look, based on what you tell me, based on what they said, based on the assessments, I don't see anything diagnosably wrong. And then they'll tell me, like, I know that there's nothing psychologically wrong, but help me with the attitude issue. I'm like, I can't. That's part of the adolescent development. They have an attitude. You want them to not have their own feelings, thoughts, emotions, and autonomy. That's part of the development. So I can help you cope with that, but I can't help them change. That's counter biology. And so I would get that quite a bit, especially with 11, 12, 13-year-olds, those parents or guardians needing help with those things. Sometimes there's an issue of sometimes there's an issue of adjustment, and so we'll help with the adjustment of living with a kinship caregiver rather than living with their biological parent, whether it be because of drug abuse or decease or incarceration. But all those things are severely impactful to a child's development anyways. So there might be something pathologically going on with the child that I can actually diagnose and treat. But sometimes there aren't. Sometimes some kids just don't have any pathology, even when they do undergo those types of situations. And so then that's a conversation too. Look, the kid has adjusted. They're going to miss their parent. I can't make them not miss their parent. They're probably always going to miss their parent and wonder what if, but I can't fix that. That's part of life now. And maybe I can help you adjust to that or help you figure out how to respond to it. But I can't fix that. I can't change it. It's not going to go away. And those types of things happen. So when she says they're treating the well, I don't know what she means. Who are they? Tell me who they are, because I don't know who they are. Who are they? Tell me, give me their number so I can call them and tell them why, ask them why are they doing this? Who are they? Who are they? And then there's a piece of the trauma-informed care in schools. I've heard about this a lot. I'm not a school psychologist, and I don't work in schools. I've worked with a client doing in-school therapy, but not working within the school system and all that stuff. So I don't know the intricacies of all of that. But I think what she's talking about, and I think she gets into it later in the video, is social emotional learning, which is actually helpful for children who have been traumatized. And again, so she's again talking about when you're treating well children. So when you're treating a population of children that don't come from homes of abuse or trauma or homelessness or poverty, and you're treating them as if they do, then they're going to come up with sort of different pathologies. I haven't seen this happen, though. This is what I'm saying. Maybe it's a geographical thing, because I don't know where she's located and I don't know where she's done her research. And I have not read her books, so I don't know anything about this woman. This is the first time I'm seeing her. But I work mostly and have for most of my career with people who live in poverty or people who are on the poverty line or from low socioeconomic backgrounds. And I also work with middle class people as well. But I predominantly have always worked with the lower socioeconomic group. And the kids in the preschools, for example, I remember my first day as a preschool teacher, and I remember a coat rack was thrown at me by a 4-year-old, and she scratched up my arms just because I told her it's nap time now and it's time to lay down. And she was screaming and she was scratching me, and she, I didn't even touch the girl. Like, I just walked towards her and she was triggered immediately. So looking back at it, like, this was before I had any clinical experience. Looking back at it, I would guess to say that child had been through some sort of trauma. If I were a betting person, I'd say it had something to do with sexual trauma, or something to do with maybe neglect, or some kind of other abuse that maybe she didn't feel like she had any control of her body at a certain point in time. And maybe I was triggering her to feel like that again because I was trying to make her lay on her cot. I didn't touch her. Like I said, I was using words like, okay, it's time to lay on your cot now. It's nap time. And that was enough to like set her off. And that is what got me into the mental health field. I wanted to help those types of kids. So I don't know, when she says that they're treating the well and trauma-informed care isn't helpful, who is she talking about? Like, I guess she's talking about the well. She did say that. But like, I just feel like this video can be so misconstrued into thinking that all therapy is bad therapy. But she does even say that it's helpful. It can be helpful. But I do think that, like, I don't know. I'm just fascinated by the fact that she's found so much evidence that, like, people are treating well children as if they're not well. And I think that they're talking about, and I think they talk about this in the video, although I'm not harping on it here, of the transgender population specifically. And so, but I'm trying to think about other contexts that applies to, and I just can't think of anything else. So I feel like that must be what she's talking about. But anyways, let's get back to the video.
I'm not someone who denies that it can be important and very useful and even curative. But when you treat kids who are actually don't have a severe problem, you're at much greater risk that the therapist will just introduce harms. And I saw it firsthand, certainly with the kids who convinced themselves that they were transgender. Very often with a therapist, the idea was reified. And we see that across the board, from everything from anxiety to depression, family alienation, the loss of a sense of agency. We're seeing in the rise of generation, they have an external locus of control in rates we've never seen before. They don't believe they can improve their own life, and they are highly treatment dependent. They think they have to call a therapist or an adult before they make any decision. These are young adults who feel that they can't make a decision in their lives.
This has not been my experience. So, okay, I understand that, like, she's talking about, she's done some research, she's written a book, and like, my experience is not going to be blanket to everybody else's, but like, I have young adult clients. They don't call me when they have to make decisions. They don't wait until therapy to have to make decisions. They just don't do that. And then clients that are highly dependent, those are usually the ones that are like the ones that are borderline personality disorder, or highly depressed and have another, what's another, I'm trying to think from experience, highly depressed or high PTSD, or high stress, like serious things going on, like their child is dying, literally, things like that. Those ones are ones that, like, that might call me outside of therapy, or might send me text messages, or might send me emails, and it's understandable because they're going through a high stress situation. It's up to me as a therapist to know how to set those boundaries, though, and say, hey, look, like, I tell my clients, it's fine that you text me, but don't expect me to respond. I'm not going to be able to respond, and I probably won't. Because part of therapy is helping you to gain autonomy and learn how to use the skills we talk about in therapy and we practice in therapy for your own life, so that you can figure out how to get through these stressful experiences. And so, and I've never had anybody yell back at me like, you're horrible, because I have that boundary. But so I don't know what she means again when she says that, like, people people, like young adults, can't make decisions without calling their therapist. My young adult clients, they make decisions all the time without calling me. We talk about it after they've made a decision, and then they reflect on the decision. Was it a good decision for them? Was it a bad decision? But I don't have an opinion either way. And I let them process that, figure that out, and then we assess how that helps them get to their goal that they had set in therapy. Or does it make them go farther away from the goal? So was it really a good or a bad choice for you? And so we'll talk about that, but I don't have ever the experience that somebody has me on speed dial. Like, I need help trying to figure out if I should break up with my boyfriend. Like, no, that's not a thing that happens. Not at least in my experience. But I guess this is titled bad therapy, so I should take it as like, oh, maybe I'm a good therapist.